Today, we have another interview in action from the conferences that just happened down here in Miami and Orlando. My name is Bill Russell. I'm a former CIO for a 16-hospital system and creator of This Week Health, a set of channels dedicated to keeping health IT staff current and engaged. We want to thank our show sponsors who are investing in developing the next generation of health leaders: Gordian Dynamics, Quill Health, Tausight, Nuance, Canon Medical, and Current Health. Check them out at thisweekhealth.com/today. Here we go. Okay, here we are at HIMSS 2022, and we are here with Ron Emerson, BSN RN, but actually the global healthcare lead for Zoom Video.
Yes.
Welcome to the show.
No, I appreciate it. Thanks for having me.
Wow. So, BSN RN.
Yes.
So you have a background in healthcare. You understand what's going on in healthcare.
I do. I was in the United States Marine Corps for 4 years. Got out. Got my bachelor's degree in nursing and worked in acute cardiopulmonary, and I really wanted to have an opportunity to learn as much about different sectors of healthcare as I could. So I did per diem home health and skilled nursing facilities, and did that for a few years before I sort of jumped into the telemedicine side.
The Zoom during the pandemic, it was really interesting because I think prior to the pandemic, Zoom was sort of on the outskirts a little bit, but then during the pandemic, I saw a study where almost was the largest used video platform for telehealth during the pandemic. And I think I think predominantly it was ease of use, right? That the consumers understood how to use it. It was just really easy for them to make those connections and make them work. Is that your understanding of why it took off so quickly?
Oh no, 100%. I mean, a few things. One is the ability to be able to, reach outside from the walls of an enterprise or a healthcare system and then reach people where they're located in their homes. The ease of use, and then of course just being able to work in the lower bandwidth environments kind of across that whole continuum is what really drove the increased utilization and made Zoom the #1 market share leader.
So what's top of mind for you these days at Zoom?
Yeah, there's a lot of exciting things. I mean, we just went through the hyper digitalization of healthcare, of course, from COVID, and I think we've all learned a lot from it, of course. And I think the one thing that there's really a couple things that we're focusing on. Of course, the world's different, and we have basically hybrid models. And hybrid models can be, what we're seeing is hybrid models are everything from how employees engage with the organizations, the healthcare systems that they work with, and then of course hybrid models of delivering care. So when you look at the care delivery model, this is pretty much it's known out there. But before COVID, less than 3% of people who could actually access telemedicine, like video-assisted virtual visits on a device, less than 3% would actually do it. Right? It was a very low number. And we know this from self-insured employers and insurance companies, right? And then, of course, COVID happened, and we saw in larger centers of excellence, this is a little bit anecdotal, but I saw 75 to 90% of all outpatient visits being done virtually. And if you look across all sectors, McKinsey did a report that said about 50% of all visits during COVID. Now it's somewhere around 8 to 17%, depending on what study you look at. But the thing we do know was that patients liked it, and it's become sort of an expectation. Qualtrics did a report, and Zoom actually sponsored the report, and Qualtrics did it. We looked across 10 countries, over 7,500 participants, and we found that 61% of people in the US that actually had done a telemedicine visit within the last 6 months said that they wanted a hybrid model of care. So they wanted to be able to see the clinician when they needed to, but they also wanted to be able to do it virtually. 34% said we just want to do it in person, and I think the leftovers, like 4%, said we want to do video only, but I don't think that's realistic. So
yeah, it's interesting. During the pandemic, we were just watching those numbers, and they were the first couple of months they were staggering because we actually closed down the facilities that people were going to. And the health system scrambled very quickly. But one of the things we found as we were looking at the studies afterwards is a lot of those calls didn't succeed. So there was it was double digits. It was over 10% that weren't making the connection. A lot of hospitals adjusted and put in different ways to make sure that those calls went through. But I'm thinking, I connect with my parents on Zoom. I connect with a lot of people on Zoom. I didn't have that challenge. Where do you think that challenge came from of making those video connections work?
Yeah, I mean, I think there's a difference between, and there's some trade-offs, right? There's different technologies. Of course, Zoom, we really recommend using an app the patient side, and when you use an app, you get better video compression, and it can tolerate low bandwidth environments better. Then there's other systems out there that use like WebRTC. WebRTC is not as controllable, but the advantage to that is you don't have to download an app, right? You can just click on it. So I think there's that trade-off of sometimes the ease of use of having people connect and the actual quality of the video. And I think maybe sort of a mixed model seems to be the best. We recommend though that if people can use an app and have that more quality of assurance, it's worth the benefit and the time of actually doing it, especially if it's kind of a longitudinal relationship with the provider.
Are we seeing health systems step back and start to integrate it into the workflow? I mean, when COVID happened, people just threw things out there to make the connection. Now it feels like, all right, things are starting to normalize. We're trying to bake this in the workflow, and we're trying to make this work for the clinician. Are we seeing that work start to go on?
Yeah, 100%. And I think it's been going on for quite some time. I mean, Zoom has been involved in telemedicine, of course, pre-COVID. Zoom was actually integrated into Epic pre-COVID. And our view of the world is, and what we believe is that there are enough different types of technologies out there. What we want to do, to your point, is take our technology, video, and we want to integrate into the workflow that healthcare providers use every day. Epic, Cerner, so that they can mimic what they're doing when they see a patient in person, but still provide that quality of care from a distance.
What about the ambulatory side? The Meditechs, the Athenas, and the other. I mean, there's so many players in that ambulatory side. Is that a place that you're seeing growth as well?
Yeah, we're seeing some growth, but a lot of that's of course it depends on volume. I mean, there are health systems that use Zoom, you could say out of the box as it is, that are doing up to 40,000 consults a month. We have some fairly large systems that just mimic the traditional workflow. They call in, they give the information, they put in the EHR, they email all the information out to the patient, they put the link in the EHR for the provider, and they're off and they're running, right? So there's different levels of workflow requirements or desires, and sometimes for the smaller clinics and practices and FQHCs, a lot of them, they're like, okay, we're okay doing it the way that it is, the model I explained. And then others, of course, when you reach a certain volume, they want that integration workflow.
Work from home. So, how is Zoom looking at work from home? And it feels like it's here to stay. I mean, we have some large organizations, Google and Apple, announcing, hey, we're going to come back. But a majority of organizations are at least saying, hey, hybrid, 3 days on. I mean, there's all that sort of going on. What does that mean for Zoom? How are you guys looking at that?
No, it's a key part of the way that we are focusing as a company. I mean, it's really about how employees can interact with the organization that they work with and for, and still be as impactful to the highest possible level as if they were actually in the building with the actual people on site. And what we do with that, we call it parity of communication. So if you have remote workers, and it's a real issue, because if let's say there's 10 workers and there's 3 that choose either not to be in, or maybe the organization says, we know this works now because of distant technology tools, you can be just as efficient at home as you can, but they're concerned that they might not be as impactful, they not be able to as engage as much. And so Zoom, we're developing technologies and working with partners where we can do even things like we call Smart Gallery, where you can be in a conference room, because we're all used to kind of the Hollywood squares. So you can be in a conference room, and in the conference room side to the other virtual participants, everyone, it'll break them up in frames, it'll make them Hollywood squares, so they have that same interaction and that same level of ability as if you were in the room.
Well, that's the one thing is that conference room experience, because I'm hearing a lot of health systems say, look, we're going to have people come back maybe 2 or 3 days a week, so we can have that vibrant interaction. But we want to maintain that vibrant interaction with those people who are going to be on that screen. So what is you just described it a little bit, Hollywood squares. And I used to say Brady Bunch, but I think they're both a little dated. I don't know what the newest would be.
Here, yeah.
But essentially, how do you make that so dynamic that the people on the screen are in the room? I mean that's the goal is that you have that interaction. What we hear from JP Morgan and Apple in bringing people back is we don't want to lose the innovation, the connection, and the interaction that you get that leads to the innovation that they're looking for.
Yeah. I mean, well, first of all, I think the first word is hybrid, right? I mean, that's so it's not all or nothing in hybrid, and be there if you need to and when you need to, and based on your role and what you do as far as what your job is. I think that's the first thing. The things that we can do is, we have mobile technologies. So you can bring technology into different environments. You can bring it into the labs. You can bring it into development areas. So we see organizations doing that as well. And then it's some of the advancements I just talked about. It's just really, how do you make it to the best of your ability, sort of immersive, and make the other people on the far end sort of a participant, just like in the room. And if some of the technology that we have now, we're able to make a lot of progress and significantly impact what that interaction looks like and how impactful it is.
So what's next from Zoom?
We're excited. We got a lot of great things going on. The hyper-digitalization we talked about, along with what we see as sort of the decentralization of healthcare in general, which is key, is when you look at the decentralization of healthcare, it's the centers of excellence here, but how do we reach across sort of that continuum of care from the home all the way to the smaller clinic and provide support and have specialty providers do that. And then the other side that's really exciting for us is, we're moving more towards capitated rates, right? Value-based care. About 35.8% of Americans in 2020 were underneath alternative payment systems. And as that moves up, it's not just about the clinician seeing the patient, but it's about basically things moving to the home, right? And then when you move to the home, it could be, how do we get people to get interested and vested in their own health? And the way to do that, we feel, is through meaningful, impactful communication. So we're excited to be that one tool that's that common thread across healthcare, from the centers of excellence to the home, to the primary care provider, and bring all that together through a more coordinated care effort as we look at value-based care models.
Fantastic. Ron, thank you for your time.
Okay, thank you so much. I appreciate it.
Appreciate it.
Okay.
Another great interview. I want to thank everybody who spent time with us at the conferences. It is phenomenal that you shared your wisdom and your experience with the community, and it is greatly appreciated. We also want to thank our channel sponsors who are investing in our mission to develop the next generation of health leaders: Gordian Dynamics, Quill Health, Tausight, Nuance, Canon Medical, and Current Health. Check them out at thisweekhealth.com/today. Thanks for listening. That's all for now.